Good morning, everyone. Thanks for joining us today. I'm Brett Moore, Executive Specialised Industries for the Business and Metro team here at NAB, and I extend a warm welcome to you and thank you for your time. Before we begin today, I'd like to acknowledge the traditional owners of the country on which we meet. I'm calling in today from Yorta Yorta in northern Victoria, and I would like to acknowledge the Yorta Yorta as the traditional custodians of the land on which we stand. I stand today. I'd also like to acknowledge all elders past and present, as well as future leaders who continue their role as proud custodians of the country they belong to. I'd also like to acknowledge our Indigenous customers and colleagues who join us here today as well. Just a very quick housekeeping point to get started today. Please note that today's event has been accredited for 1 hour of continuing professional development for allied health professionals, dental practitioners, medical practitioners and pharmacists. After this event, you'll receive an email from the team containing your certificate of completion, which you can upload to your relevant CPD home. So let's get started. It's great to be able to today launch our 12th year of NAB Health Insights, which dives into the Australian healthcare system, importantly, all through the eyes of the Australian consumer, health consumer. NAB has supported healthcare professionals for over 160 years, whether that be the individual practitioner who's buying their first piece of equipment and is supported by Medfin Finance, through to the GP who's looking to corporatise their business or heading through to retirement. NAB Health is proud to support you and your healthcare business. I'd like to welcome our expert panellists today. I'm joined by Alan Oster, known to many for over 32 years. Now, Alan has been NAB's Group Chief Economist. Welcome, Alan. Dean Pearson, his ally in the economics team. Dean is our Head of Behavioural and Industry Economics. John Event, who's the Executive for NAB Health. Welcome, John, and also Medfin. And Simon Terry, our Executive for HiCaps. The format for today, we're going to hear from Dean first, who'll take us through the latest insights from the NAB Health report. I'm then going to join Alan in a fireside chat to talk about the global economy, nationally what's happening, and then what we can glean specifically for the health profession from the report, and more broadly what's happening within our economy. And then John Event is going to facilitate a question and answer session with Simon and Alan. So I'd like to now throw it to you, if I could, Dean, as I affectionately know him, the Bruce McAvaney of economics, the keen stats man, to take us through the latest NAB Health Insights, Australia's Health Scorecard. Over to you, Dean.
Thank you very much, Brett, and good morning, everybody. Well, as Brett mentioned, Australia's healthcare system is really considered to be amongst the best in the world, providing safe and affordable care for all. But what we were really keen to discover is, do Australians actually agree with that sentiment? So today we will be releasing the first of what is a 3-part NAB Health Insight series, exploring the state of healthcare through the eyes of the most important stakeholder group for all of you and us, the health consumer served by the system. Now, Australians have told us in this report about their usage of health services, their experiences with wait times, access, affordability, and their overall satisfaction with health professionals and the system of the whole. And that, in effect, provides a scorecard on the state of healthcare in Australia today. Now, I don't need to remind any of you, but healthcare is unlike most other sectors of the economy. It has a very unique correction to our shared national values, particularly those values around equity and citizenship. At the same time, public perceptions and experiences with healthcare services are really important in identifying how well a country's health system is meeting the needs of its population. Those expectations can also help frame future demand, help funding, and also payment models. Now, overall, these are going to be predominantly very positive views, I think. There are clearly some areas for concern, but what is really clear is that patients continue to have a particularly high regard for the health practitioners that continue to support them so strongly. So moving on, I promise there's not too many PowerPoint slides, but I just want to give you some of the highlights. And firstly, patient satisfaction is often termed in the same way as patient experience, but really they're quite separate concepts. A patient's experience is based on what should happen during an appointment and whether that actually occurred, whereas patient satisfaction is based on whether a patient's expectations of what should happen were actually met. So why, in fact, should it actually matter whether patients are satisfied as long as they are receiving good health care? And the simple answer to that is it can lead to patient loyalty, it can lead to better clinical outcomes, but also patient compliance. And in practical terms, it starts to see the patient as a consumer of health services. And that requires often practitioners to address a number of issues beyond just care. So how satisfied are Australians with our healthcare system? And the answer is only moderately so, as you can see here, scoring on average around 6.5 out of 10. If you compare those sort of results to a country such as Singapore, which consistently gets scores of 8 or higher. However, it's probably worth noting that Singapore has a population of just under 6 million people, has a very centralised administration, which means predictable financing, strong public health and healthcare delivery systems, which really gives the government a great deal of control over how care is ultimately delivered. Now, 80% of primary care is delivered through the private sector in Singapore, while 80% of all acute care and 100% of hospital ownership is public. And all services include at least some form of cost sharing. But if looking here at Australia, satisfaction with healthcare does vary a little across the country, and particularly in some key demographic groups. And you can see here it's ranging from about 6.6 in capital cities down to 6.1 in rural areas. Around 7 million people, or 28% of the Australian population, live in rural and remote areas. And these Australians clearly face some quite unique challenges. Now, I think in a nod to Australia's universal health coverage, income was really not an important determining factor in looking satisfaction levels, which were spread really quite narrowly, as you can see, between the higher income group and the lower income group. Importantly, NDIS participants scored above average satisfaction. 1 in 2 were very satisfied with healthcare in Australia, which is not, however, to deny that on many measures, health inequalities in this country are widening. We know the burden of disease and inequality for Indigenous Australians remains more than 2 times that of non-Indigenous Australians. People who live in rural and remote areas continue to experience poor access to healthcare and also poorer health outcomes than their metropolitan counterparts. And we know general practice in this country is still in the midst of a funding and a workforce crisis. Now, moving on to the next slide, please. What about health consumer satisfaction with their own health? Now, Australians are only, again, moderately satisfied with their health. And when we were asked them to rate their satisfaction, they scored about 6.6 out of 10. Satisfaction, again, was higher in capital cities and lowest in the rural areas. Significantly more people in rural Australia scored their satisfaction very low. Men rated their satisfaction, perhaps not surprisingly, better than women. Now, men are often a lot more optimistic than women, and this is remarkably consistent across a whole range of issues, and that optimism clearly extends to health. What is interesting, of course, though, is the facts really still belie this. Men die younger than women. They are more burdened with illness during their lives. By age, interestingly, overall health satisfaction was lowest amongst the 18 to 24-year-old group and highest amongst those aged over 65. Around 1 in 2 Australians over 65 scored their satisfaction very high. Now, clearly, while older people have more physical and cognitive impairment than younger people, this advantage clearly flips when it comes to mental health. In recent decades, researchers have noticed a really quite consistent pattern, which is consistent not just across different cultures and countries, but it also includes ours. And that is that most people's happiness and their life satisfaction tends to fall in our teens. It falls again in our 20s and 30s. It troughs again in our late 40s. And then it starts increasing, and it increases well into our 80s. So put simply, young people tend to overestimate their future happiness, so feel somewhat disappointed as life goes on, while as we start to get older, the good news is we start to underestimate our future happiness, so we are increasingly pleasantly surprised. Now, it's also, of course, conceivable that there are changes in socioeconomic factors that are impacting young people and young men and women also than older people. Now, money clearly helps here. Australians in the higher income saw their satisfaction with their own health much higher than those in the lower income group. 4 times as many people on lower incomes saw their satisfaction with their own health as very low. Now, encouragingly, the number of Australians who tell us they are prioritising their health more over the past year has increased now to 44% of the population. The real question is, should we actually believe them? Now, as David Ogilvy, the so-called father of advertising, once famously noted, the problem with market research is that people don't think how they feel, they don't say what they think, and they don't do what they say. So when people respond to surveys, often It's not that they're lying, it's simply that really they don't know what they're going to do. And quite often, and I'm included, sometimes we can't even recall accurately what we've already done. So while consistently about 6 in 10 of Australian consumers will say that they're eating healthier, in reality, most of them are not. So that raises a question, a personal question for me. Why have I wasted my entire career in research? Well, for one major reason, and that is that inconsistencies are really quite often opportunities. These sort of say-do gaps are actually really valuable insights. Often there are considerable lags between thoughts and action. People might really want to do something, but for whatever reason, they don't do it. Now, if we can uncover some of the reasons, that will help identify sort of barriers that are stopping people from matching intention with action, I think we can help. Now, regardless of what people are actually doing about it, a growing number of us are clearly stating that we want to live better and healthier lives. Now, to move to the next slide, please, any discussion on health satisfaction and outcomes really needs to consider ultimately who is responsible for our health. Now, during his time as British Secretary of State for Health and Social Care, Matt Hancock famously triggered a really vigorous public debate after he urged people to really take a greater control and greater responsibility for their own health to tackle the rising toll that he was seeing of illnesses such as cancer and obesity. Now, that didn't go down particularly well with a number of health advocacy groups who described his comments as naive and victim blaming, and that believed any focus on individual responsibility would ultimately let the government off the hook for their record on health inequality. Well, now, what is really true is decades of health research has shown that our health is not only determined by our personal choices, but also clearly the conditions upon which we are born, grow, live, work, and age. The poorer you are, the poorer the area in which you live, the much less likely you are to have a stable job, to have that control, a decent house, or a decent income upon which to afford a healthy diet. All of these things clearly affect health. However, at the same time, it's also important to note, and he was right, health outcomes are clearly a partnership. They're a partnership between government, between health providers, communities, and ultimately all of us as individuals. So to what extent do Australians believe they are ultimately responsible for managing their own health? And you can see here, our findings suggest they do believe so to a very large extent. When asked whether they agree with the statement that I am responsible for managing my own health, over 7 in 10 Australians marked their agreement very high. They scored that statement on average 8.2 out of 10. Only 3% of the population scored that statement very low. So the former UK Health Minister was right to emphasise that there is a need for effective prevention epidemics to stop epidemics such as obesity, diabetes and dementia. What he should have also acknowledged, however, is without proper funding and policy change, a preventative health strategy was unlikely to succeed. Now, moving on to the next statement, please. We were really also keen to examine if there was a relationship between patient characteristics and overall satisfaction with care. Over 3/4 of Australians have at least one long-term health condition. Nearly half of us have at least one chronic condition. We know mental and behavioural conditions, back problems and arthritis are amongst the most common chronic conditions. So how satisfied are those health consumers with an actual health condition with the care they receive? And you can see here, they are considerably more satisfied with the quality of their care than they are with the system as a whole. Around 6 in 10 were very satisfied. Now, some of the key predictors of patient satisfaction are typically socio-demographic factors, including age, distance to care, number of visits, wait times, as well as factors such as improving values and attitudes, cleanliness, safety, effective care and affordability of medicines. Again, satisfaction with care received was substantially lower in rural areas. Satisfaction also, quite importantly, fell with age. It fell from about 8 for the over 65 group to 6.4 amongst those aged 18 to 24. Income, again, is a big differentiator here, with satisfaction amongst those on higher incomes considerably higher than that of those on lower incomes. Now, moving to the next slide, please, we can see from the latest NDIS data that the scheme is now supporting more than 630,000 Australians, and that includes almost 24,000 new participants who entered in the September quarter alone this year. And in our survey, almost 1 in 10 Australians identified as current NDIS participants. That ranged from around 12% of the population in regional areas to 6% in capital cities. About 14% of those aged 18 to 24 compared to 4% for those aged 45 to 54. 13% of those on lower incomes compared to just 5% of those on higher incomes. Now, according to the NDIS, over 3/4 of all participants aged over 15 years and over consistently report having greater choice and greater control in their lives. But there is one important aspect of the NDIS process, which is payment processing. And we know historically healthcare payment systems have been somewhat cumbersome and difficult for some to navigate, which has resulted in poor user experiences for healthcare providers, but also patients alike. So we're also keen to explore how easy the current payment request process was from a patient perspective. And the answer is, as you can see, only moderately so. Just over 1 in 10 Australians said that their current payment process was extremely difficult. Around 4 in 10 believed it was moderately difficult. Around 3 times as many people on the lower income cohort found it very difficult compared to those on higher incomes. Now, moving to the next slide, please. While Australians were only moderately satisfied with the healthcare system as a whole, importantly, in the eyes of patients, there is a very distinct difference between healthcare, one word, used to describe the system as a whole, and healthcare, 2 words, which refer to our health providers' actions. Satisfaction with the latter in terms of quality of care, advice, or treatment they have received from health practitioners remains very high. Now, as you can see, it does vary, and it has moderated somewhat compared to last year when we last looked at this issue. Australians rated their satisfaction highest overall for optometrists, chiropractors, osteopaths, physiotherapists, private hospitals, pharmacy, dentists, other health providers, and vets. It was lowest and scaled back most for public hospitals, psychologists and psychiatrists, and GPs. Now, moving on to the next slide, please. One of the key reasons that Australians are satisfied with their personal health care is ease of access. Although it too, as you can see, has slipped somewhat compared to last year, Australians continue to agree that it is still very easy to access or use pharmacies, optometrists, chiropractors, osteopaths, and physiotherapists. Getting to see or use a dentist, as well as another health provider, a private hospital, or a GP, was also considered to be quite easier, though again, a little harder than in 2022. It was moderately easy to see a specialist doctor, a public hospital, a psychologist, or a psychiatrist, with ease of using and accessing a public hospital and a psychologist and a psychiatrist, noticeably harder than it was back in 2022. Now, clearly, the surge we're seeing in people seeking help for mental health issues is no doubt playing into that increased difficulty in seeing a psychologist or a psychiatrist. We know that almost 1 in 5 Australians told us that they had a diagnosed mental health illness or disorder in the last year alone. 1 in 3 at some point in their life. In addition to that, over 1 in 3 have at some point in the past 12 months believed that they needed professional help for their mental health. Though encouragingly, that has slipped a little bit compared to about 43% of the population a year ago. In rural areas, however, the number that felt that they needed professional mental health support rose to 46% of the population compared to 34% a year ago. Now, while a large number of Australians felt they needed professional help, only around 1 in 2 were able to get access to the help that they believed they needed. Over 4 in 10 endured wait times ranging from a month to more than 6 months. Interestingly, over 8 in 10 Australians who access care did so with a professional face-to-face. We know affordability is an important barrier to care, but it is not the primary reason. The most commonly given reason for over 1 in 2 people was they felt that they could manage on their own. Now, we know that despite progress in recent years in bringing to light the really important message around mental health care, many people are still afraid of being stigmatised if they seek help. Now, moving to the next slide, please. In terms of usage, we can see over the past year, GPs, pharmacies, and dentists were again the most commonly visited health practitioners. Visitation was highest for GPs, where just over 7 in 10 Australians had visited a GP in the past 12 months. However, that was down from almost 8 in 10 in 2022. We know some patients are delaying or avoiding GP appointments as the cost of living continues to bite. There is evidence of fewer standard consultations taking place in many parts of the country. Health consumers are also stockpiling a longer list of medical issues before making an appointment. A similar trend was observed, as you can see, for pharmacies, with the number visiting falling to 6 in 10 compared to 7 in 10 in 2022. We also noted a small decline, as you can see, in the number that used a public hospital. By contrast, slightly more people encouragingly visited a dentist, around 1 in 2 in the past year. Now, that may in fact reflect the tail end of backlogs of people who unfortunately postponed their care during the pandemic. There was also a sizable increase in the number of Australians that visited an optometrist, as well as a smaller increase in the number who visited a specialist doctor. Now, moving to the next slide, please, which really is all about cost of living. We know Australians consistently tell us, about 6 in 10, that living costs are the biggest overall cause of stress in their lives. That is ahead of their own personal health, access and cost of healthcare, and family issues. Australians spent an estimated $241 billion on health goods and services in 2021-22. That equates to approximately $9,365 per person. Around 15% of all expenditure comes directly from individuals in the form of out-of-pocket expenses. Now, when Australians who had visited or used a health practitioner in the past year were asked how affordable the care they received was, you can see it ranged significantly across providers. Australians reported a deterioration, however, in affordability for most relative to 2022. Now, outside, of course, of public hospitals, affordability was rated highest for pharmacies, GPs, and optometrists. It was largely unchanged for chiropractors, osteopaths, physiotherapists, and private hospitals, but it deteriorated significantly for other health providers. The least affordable providers were considered to be vets, psychologists, psychiatrists, specialist doctors, dentists, with affordability for all of these categories worse than a year ago. Now, moving on, please. This is really, quite a telling slide too, that out-of-pocket costs for patients have risen due to a whole range of issues, including doctor shortages, reductions in bulk billing. We've, seen patients in some areas foregoing or deferring care. Wait times, we can see, have also started to increase for many services, while access has been reduced for some drugs and some technologies. Health insurance premiums and co-payments have also risen at the same time. Now, to gauge consumer perceptions of health cost changes over the past year, we asked Australians to rate how the cost of services provided had changed. And you can see perceptions are they've become more expensive for all providers. Now, looking there, the most notable increase for around 3 in 4 Australians was in veterinary. Around 2 in 3 also said it was more expensive to see a dentist, a chiropractor, an osteopath, a physiotherapist, a pharmacy, or a psychologist and a psychiatrist. Around 1 in 2 Australians said GP services were more expensive. I think the next slide, if we can go to, please, is perhaps one of the most significant and telling. Though most Australians believe health services have become clearly more expensive, there are a fewer number of Australians that report having cut or cancelled their health spending due to cost of living pressures compared to last year. It really does suggest that more consumers are choosing to prioritise their health. They are clearly making cutbacks, but they're making cutbacks in other areas. In 2023, 3 in 10 Australians responded to cost of living pressures by switching to lower cost prescription items and medication. That is down from 4 in 10 in 2022. Around 1 in 5 cancelled or cut back on regular dental appointments. That compares to almost 1 in 3 in 2022. Far fewer have also cut back or cancelled optometry visits, medical treatments and procedures, chiropractic, osteopaths, physiotherapy appointments, psychologists and psychiatrist appointments, and on private health insurance. The only area where we can see health providers have not changed much was not cutting back on prescriptions being filled at a pharmacist. Now, moving on to the next slide, please. We have also saw, as I mentioned before, that uplift in dental visitation. However, many Australians continue to fall well below of what the Australian Dental Association guidelines are for visitation. Indeed, almost 1 in 2 Australians have not visited a dentist in the past year. Cost is overwhelmingly the main driver for not visiting a dentist. And what we are seeing, as we predicted, is wait times for public dental treatment are starting to increase again in many parts of the country. Wait times for dental care with existing problems are worsening. More than 1/3 of all courses of care treatment in the public sector are now for emergencies rather than routine or preventative treatment. I think it's also significant that fewer people identified not having a reason to visit a dentist as one of the reasons that they didn't go. Presumably, that's reflecting delayed visitation has really compounded some of those problems, those dental issues that may have been ignored or gone undiagnosed during COVID. So if we move to the next slide, please, I just wanted to finish with a couple of slides that really address the health consumer experience, because we know that healthcare is becoming much less transactional and much more experiential. Patient experience expectations are clearly evolving. The pandemic has accelerated that shift to more convenient, more human-centric, more simple healthcare experiences. Patient retention, importantly, is increasingly being tied to the experience that patients find. Healthcare consumers are growing a lot more comfortable, though, switching providers when their current provider isn't meeting their needs. Although it's somewhat, as you can see here, much more common for some practitioners than it is for others. Now, since the pandemic, so we asked people over the past couple of years, 2 to 3 years, the highest level of patient switching has clearly been amongst GPs, where around 1 in 7 Australians have switched. The next most common incidence of switching was for dentists, where 1 in 10 Australians have changed their dental provider. You compare that to some of the other specialists here. 1 in 20 have switched their specialist doctor or pharmacy. Even fewer have switched their optometrist, their psychologist or psychiatrist, chiropractor, osteopath, physiotherapist, vet, or other health provider. Now, these sort of levels of switching, if you compare to the US, for example, are still very low, but are clearly worth monitoring. We know that our previous NAB research has shown that cost is the primary reason for people switching. And the latest annual data shows Medicare bulk bill rates are now at 77%, and 80.2 for non-referred GP appointments over the 12 months to June. That's the lowest level recorded since 2013. And while cost topped the list, not far behind was lack of care and compassion, difficulty in getting an appointment, and not listing. Now, there are numerous surveys exploring how soon doctors interrupt their patients. Now, I'm not sure I believe this answer, but the median is often reported as being 11 seconds. Time is really clearly important here too. It's an important motivator to switch, with too much time spent in waiting rooms, getting an appointment, and feeling rushed. Also really important reasons why people are switching. Now, switching is much more common amongst younger people, especially Gen Zs and millennials. People aged 18 to 24 are nearly 6 more times more likely to switch providers, along with those 25 to 34, particularly GPs. We know that 1 in 5 people switched their GP amongst the younger cohort in the past 2 to 3 years. About 20% of that age group also switched their dentist. If you look at, the comparison between the younger group and the over 65 is very stark. About 9 in 10 Australians aged over 65 have not switched any health professional since COVID. You compare that to just 1 in 2 of those patients aged 18 to 24. So let's finish on this last slide, please, because patients are clearly wanting more from their provider than just good care. We also asked health consumers their most important consideration when searching for a new doctor or a new health professional. Almost 6 in 10 identified convenience as the key factor. 1 in 2 were also looking for a health provider that offered bulk billing or was easy to make an appointment. Now, in the past, healthcare consumers have routinely ranked patient-provider relationship as their top priority. Convenience now has clearly surpassed that in recent years. Some of the other important concerns you can see there are around out-of-pocket expenses, convenient hours, valued qualifications, recommendations from family and friends and other health professionals. Only 1 in 10 said they were influenced by patient or positive online reviews, and less than 1 in 10 by access to telemedicine or virtual visits. Now, the importance of bulk billing in that result is not surprising. When we again asked Australians whether they were bulk billed this time when they visited their doctor or GP, the number has fallen noticeably to around 63% from 71% last year. So to sum all that up, I think the really good news is Australians are largely satisfied with health overall. They are particularly satisfied if they have an ongoing mental or physical condition. Patient satisfaction for most practitioners remains very high, although, as you've seen, it has moderated for all practitioners, and satisfaction is higher in capital cities when we compare that to regional and rural areas. Now, while this survey clearly found that GPs, pharmacies, and dentists are again the most commonly visited practitioners, there has been a drop in visitation across several areas, including doctors and pharmacies. Cost is probably a factor here, with Australians reporting a deterioration in affordability for most providers. Access to care too could have played a role, because while access is generally still very good, it too has worsened compared to last year. So I think while there are clearly some areas for concern here, What is very, very clear is patients continue to have a particularly high regard for the practitioners that continue to support them in their health. Thank you very much, Brett.
Dean, thank you. As insightful as ever, Dean, thanks very much. At last week's sessions that we did in person at the events, your presentation sparked many questions from the audience, and I'm sure as you rolled through that today, there will be lots when we go to the Q&A at the tail end of this session. Turning now to Alan Oster, as I said off the top, Alan has been at NAB and is our Chief Economist for over 30 years, and before that worked at the Federal Treasury. Alan has researched, dissected and written on the highs and lows of the Australian economy. He's seen it all. And so with that wisdom and experience, I really look forward to, Alan, your reflections today. Welcome.
Thank you.
Maybe just if we could start at the macro level, the world clearly is very unsettled at the moment. We see the conflicts in Russia, or between Russia and the Ukraine, and now the renewed tensions in the Middle East. Hard to capture in a relatively short period of time, Alan, but how's this impacting the global economy?
Well, I suppose what we're saying is there's a lot of geopolitical risk, and you can't really put that into your core forecast. So a lot of the sort of things that, if you're looking at what happens if petrol prices double because of the Middle East, we'll do that in a stress test. And so we're sort of assuming that we don't get massive effects from geopolitical issues in the near term. What you do, however, see is that the central bank actions in terms of tightening rates do now look like they're having an impact. And so on monetary policy, they always talk about long and particularly variable lags from monetary policy. What we're now seeing in just about everywhere other than maybe the US, that the economies are slowing. And you see very, very sharp slowing, particularly in manufacturing. So if you're thinking about economies that run on manufacturing, think particularly Germany, think Japan, China, all those economies are doing it really tough. The service sector has been hanging in there, but it's sort of starting to weaken a bit as well. So, if we look at China, I always get asked about China. Again, it's got issues associated with property. It's got issues associated with the retail, or basically consumers don't want to spend, and the growth rates don't look great. So when we look at the world, what we're saying is this is going to be a tough world. Forget about geopolitical risk. It's going to be a tough world regardless. And, we're talking about 2.5% for growth next year globally in GDP. And that's about 1% below long-run average. And in more very simple terms, outside of COVID and basically the global financial crisis, next year is going to be the worst year we've had since 2000. So that's tough. It means that there's a lot of uncertainty out there as well. And then I think the other interesting issue that we're now seeing is, depending on how bad your economy is traveling, people are speculating, particularly markets, about when the rate cuts are coming. And really the message is, the harder your economy is doing at present, the shorter the time before they cut. So if you're looking around the world, Europe, by March, April, very soon. US, Canada, New Zealand, middle of the year. There were some Fed speakers out overnight who were talking about, we're getting close to time for cut. And in Australia, if I jump ahead a little bit, on Australia, I'd say we're expecting rate cuts by the end of 2024. So Australia, in some ways, is a little bit behind the rest of the world, both in inflation coming down and also in terms of when the monetary policy response is likely to show up.
Thanks, Alan. And maybe that's a good segue to turn to the Australian economy in the context of what you just outlined really clearly globally. It's a relative game. I assume will be part of your answer in terms of the Australian economy. But how do you see that global footprint impacting the Australian economy in 2024?
Okay, so we'll move to the next slide, which has sort of got a lot of words on it. And what we're sort of saying is the Australian economy is slowing. It's, again, long and variable lags, and it's hard to match or hard to exactly identify when the crunch is going to peak, if I can put it that way. What we are seeing is interest rate effects in terms of the mortgage population. So if you've basically got an average mortgage of what, 500,000, something like that, you're paying 2,000 a month extra. You've also got issues with people coming off fixed loans. And a thing that I think is important, people always say a third of Australians rent, a third have mortgages, and a third own their house. And so it's only the 1/3 that have mortgages that have problems. That is not true at present, because we've got a very high increase in migration, which is putting a lot of pressure on essentially the bottom third of the income distribution that basically are renting. And so we sort of see a lot of stress. We talk a lot to some of the charities, and they tell us some pretty awful stories, like the need to purchase car regos because people essentially are living in their cars. And you also see a lot of stress, and you see it in the, how stressed do you feel? Dean's put out a survey recently that just said the areas that are huge amount of stress are basically from 30 to 49, the mortgage mate, but they're very stressed also at the bottom end. Now, consumption has actually been slightly better than what we've expected it to be, and a lot of that is explained by migration. So there's more people coming in, and they have to live, so they have to eat. But if I said to you, if I look at consumption per capita, this is worse than 1990. A lot of stress. What are we expecting? We expect growth from December this year to December last year of about 1.5, maybe 1 3/4 in 24, and maybe more like 2.5 during the course of 25. So it's basically about half of what the growth rate was last year, is sort of a one way to describe it. The good news, and what's really different from, say, 1990, is the unemployment rate's really low. And one of the, we look at a lot of our own data, and particularly we can see the spend that's going on. We can see Black Friday, etc. But we can also see where people are getting their money from. And so as of Saturday, I can tell you, not very many NAB people were actually being paid the dole. In fact, it's sort of running along at really low levels. And it's saying that labour market, even as of Saturday, was really strong. And so we're sort of saying we expect unemployment to stay roughly around where it is at present, around 3.7 for the next month or so. And then we expect to see unemployment go up to about 4.5%. And being in a bank, everybody says, oh, well, who do I not lend to in that environment? And maybe there is some discretionary retail issues, and maybe some commercial property issues. But overall, what we're seeing in the economy is the economy keeps generating jobs. But let's say they're doing 20,000 a month and they need 40,000 a month to stabilise the unemployment rate. So the unemployment numbers basically sort of say that there will be a significant increase in the number of who have had unemployment as a real life experience, but basically not a lot of firing. Now, the other thing is inflation, obviously, and what people need to understand is what the Reserve Bank is trying to do is it is trying to get inflation in a core sense back to the target of 3% by the end of 2025. So they're prepared to have inflation run above target for 2 years from here. The real issue is, well, will you get there? And based on their last forecast, they're slightly concerned. And the reason they're concerned is not because goods inflation hasn't started to come down, it has. Because think of, if you like, the supply chain issues, they're showing up. But essentially, if you're thinking about services, and services are like health, education. Our governor got into trouble because she said haircuts the other day. And also you get issues of, transport, things like that, and going out to restaurants. Rest of the world seeing services inflation sticky and high. Ours is going up. It's not slowing at all. And so, therefore, it's really hard to get inflation to come down as quick as you would otherwise expect. You're going to have a tight labour market, mean wages are going to go at 4%. You've still got electricity prices. And at this stage anyway, the consumer on services says, well, I still want them. And businesses in services say, well, I can put up my price. And they do. And so that just means that when the RBA does their sort of analysis, what they found that underpinned the November rate rise was that they got to 3%, but only by December 25, and that included another rate rise. So the issue for us when we look forward is, will there be anything that makes the Reserve Bank feel nervous about what's happening on services inflation? Now, there's a CPI coming out for October, or it's just come out, and it will show some slowdowns, but it doesn't cover much services. And so you don't get the full read on services until the full quarterly CPI that comes out in January. And in February, you also get a new update of the RBA's forecast. So we look at it and we basically say, we think that essentially what's going to happen is that they're more likely than not to do one more rate rise in February. Now, it's fine-tuning. It may not happen, depends on the data. But just as the way the data is falling at present, you'd basically say they're probably more likely than not to increase. And then, it's fine-tuning. It's not really trying to say, I need to do another 0.5 or 0.75%. It's just, I might do one more and wait and see. So, and then we have, as I said, a rate cut from about November, and then slowly. So maybe 25 points a quarter, which doesn't get you back to neutral until 2026. And we think neutral might be a cash rate of around 3. Right. So it's sort of saying things are tough, but it's policy induced. The other thing I would say is, if I'm right and the government's right in terms of what they think by 2025, that's going to be a pretty good outcome. You're going to have growth at 2.5%. You're going to have unemployment, hopefully with still a 4 in front of it. And you're going to have the inflation target back into the range. Very few countries in the world have that. So I'm quite optimistic in the medium term. I'm not so optimistic in the short term, but that's a policy response.
It's a good answer. A lot in that. And what I might just remind participants to throw their questions in the chat, because we're about to start a Q&A with Alan and Dean. Alan, can I move please to the health sector specifically?
Yeah.
And I know within your economics team that you aggregate and analyse huge swathes of customer data. What are you seeing specifically for the health sector?
So this is basically some of our so as well as looking at the consumer data and where they're spending and where they're getting the money, we also get the business bank customers. And each month they make a projection of how the revenue's gone. And that's what this chart's showing. So overall, not a lot of growth, around 2.5%, 3%. But the strength at present is health. So people and businesses are reporting that they're getting a kick up. Maybe they're coming out of COVID, but they've got a kick up. You see it also in arts and rec. So that's Taylor Swift and Paul McCartney, etc. Construction's still strong, retail's okay, but the areas that people don't like, they don't like spending on power, they don't like necessarily spending more on transport, petrol. Agriculture is a bit of an issue, and mining is good, but it's not as good as it used to be. Now, this data also includes hospitals and GPs. We do have data that just looks at essentially the NAB data for high caps. And so if I just move to the next slide, I'll just show you what it's showing. It's saying, so the red there is an index that we built using high cap data. And basically it's showing what happens through time. Back in the early 2000s, high caps were going faster because it was sort of launching. Where we are now, it's coming off a little bit, but not really a lot. It's still pretty strong. Maybe the GPs and the hospitals are doing slightly better than others, but generally it's still a strong area there. And then if I just move to the final slide, Brett, so that we can actually do this by postcode. And I'm not going to spend a lot of time on postcodes, but it sort of says the areas that are growing fastest across Australia tend to be allied health. So think acupuncture, speech therapy, massage therapy, podiatry, etc. The areas that are not doing so well, particularly optometry. And what I see there is basically, particularly in Victoria, it's going backwards, and New South Wales is not strong. But generally, you can see various bits as where they are. The other physio is doing pretty strong, and dental service around 7%. So that just gives you a big picture in terms of what we look at. And my sort of overall view is health. If I have to be in an industry at present, it's in health, and which is why we sort of try and specialise in it. And the dynamics going forward of an ageing population and people wanting health means that there's going to be a strong demand there for a long time.
Yeah, I'll echo those sentiments, and I'm sure John will when he joins us as well, that we absolutely at NAB are open for business for the health sector. And your data today would support why that's really clear, Alan. Thank you. Maybe could I just finish, and I know Simon is going to talk briefly about HiCaps in a moment, but just how from an economics perspective, you're using HiCaps data to analyse consumer spending in the health sector. What does it show through 24? And just, I know you've touched on that briefly at the end, but just any final comments on that, Alan?
Oh, look, I just think we're going to continue to see this sort of pattern emerge.
Yeah.
The government's obviously thinking about trying to do things that make it cost of living less an issue, which causes problems for pharmacies and things like that. But ultimately, I just see the underlying dynamics of the health industry is going to continue to be outpacing the rest of the economy.
Good. And is your glasses half empty, half full relative to health specifically? I know we could talk more broadly about the economy.
Oh, look, I think it's more than half full.
Yeah, wonderful. All right. Good stuff. Alan, thank you. I know there'll be questions for you, and you'll be back later on with answers to those from the panel. Could I please bring in the panel, and maybe it's a good segue for me to throw to you, John, to host this sector. John, as I mentioned before, is our health executive, and open up some questions. Over to you, John. Thank you.
Thanks, Brett. And look, thanks, Alan, for those really insightful look into the macroeconomic environment, and Dean for your sort of take on the wellbeing, satisfaction, behavioural aspects. They're really important topics there. So thank you for those presentations. Look, there's some, it's a good time for Q&A now. So I'd love to get your questions in the chat. If you've got any questions you'd like to ask any of our panel, we've got a few minutes here to get through a few questions. So please pop those in the chat and we'll do our best to get to them. So I've got a couple of questions already. One is around NDIS, and it talks about obviously NDIS being a really important part of the health sector and growing. Just keen to sort of, the question is what's HiCaps doing to support NDIS participants and service providers?
No, thank you very much, John. I mean, obviously we are we're very aware that the NDIS is, now a major Australian social program with significant expenditure to support the care needs of over 600,000 Australians. There's obviously additional opportunities. Not every person with a disability gets their support funded by the NDIS. So the disability sector as a whole is a significant opportunity for care providers. And HiCaps wants to, make sure we're making that easier. People on the call would know that the NDIS can be a complex environment in which to operate. There are registered and unregistered providers. There's 3 different sets of rules depending upon whether a participant is self-managed, plan-managed, or agency-managed. What we've done as HiCaps is this year launched NDIS Invoice Anyone, which is a process to enable a provider to lodge a claim simply through one channel. We then support a really quick authorization of that payment and help speed up the payment flow for the provider. Our goal in doing this is really to help HiCaps' over 100,000 providers to reach into the NDIS and be able to, expand the availability of services to participants in the NDIS. In many areas, the NDIS still has access issues. in terms of being able to deliver the number of services required. And we think that can be best addressed by expanding the market of providers, and particularly allowing providers who may not be registered NDIS providers to capture their opportunities in the scheme. So thanks very much for the question.
Thanks very much, Simon. Dean, one for you here. We talk about behaviour and sort of experiences people have with healthcare. How has the consumer's perception of service changed in regards to healthcare?
Yeah, it clearly has. The importance of relationship is clearly still there for a consumer, particularly for older consumers. But what we are seeing with younger people in particular is a change in what their perception of loyalty looks like, and the importance of value. And value for a younger person is not just cost, but it's increasingly cost, but it's also access, being able to access care on their terms when they need it. And, we do a lot of research in other sectors of the economy as well. There is, I think it's significant that people are still preferencing health over other areas, because as Alan will tell you, our data will show they are clearly cutting back on some areas of the economy, as opposed to healthcare, where they are doing their best, along with things like school fees and some of their expenses on their children. These are the last things that people want to cut. Now, that doesn't change the fact that, when 1 in 5 young people between 18 to 24 have switched their GP or their dentist in the last 2 to 3 years, that's a really significant change. So I do think that and I think many health professionals are doing it. They're understanding that the concept of service has to be more than just great healthcare. It has to be access, listening, and a whole range of other things. So it's a positive story, but it is a watchful thing to look at. When we put the report out, I've shown just aggregate slides today. There's a lot of demographic detail in that report, which clearly shows that younger people under 40 view many of these issues very differently, as do the over 65s.
Thanks, Dean. Appreciate that. And look, there's another question here. It's I'm not sure who's best to take this one, but it's around we talk about the tight labour market and unemployment being at really low levels. And I'm sure we've all experienced this, where we try to get an appointment to see a GP, and once upon a time you could sort of ring at 8:30 in the morning and get an appointment. These days you've got to be well planned out. So how do we see the sort of scarcity of GPs impacting the health sector growth over the medium term?
I'm not sure who should answer that one.
I don't know. I think you're talking, Alan, so how about you have a go at it?
Oh, okay. Look, I just think it's part of the process that, there's a shortage of supply on the labour market. And one of the things that people, or I hope the government starts to do, is to allow sort of overseas qualifications to be better recognised. And in terms of doctors, there's not a lot of profit in the GP system at present. And I think one of the issues is, and some of the stuff that Dean's talking about, is that people just say, well, one way I might save is going to the public hospital, which costs the system a huge amounts of money. But to me, it's sort of just the issue about, can you survive as a doctor in this current environment? And that's tough. There's demand there, but you've got to make money out of it as well.
Yeah. Thanks, Alan. Simon, another one here that probably best for you. It's around the trends in the provider marketplace. So maybe talk a little bit about the trends you're seeing in that space, if you wouldn't mind, please.
Yeah, look, I'm probably building off Alan's points. There is a lot of challenges in the GP market with that transition that is going on around, particularly moves from bulk billing arrangements to patient paid arrangements. We're certainly, in our conversations with the GP sector, seeing a lot more discussion of really kind of proactive revenue management opportunities. So looking for opportunities to support care programs and some of the higher value billing opportunities, and seeking to partner with, data providers to be able to, provide insights. So HiCaps has been working extensively with a range of partners for supporting not just dental practices, but also GP practices with data analytics platforms. There's also obviously the key issue that many practices are confronting, the need to examine their employment arrangements and getting advice on the structures that, particularly for independent contractors, with recent decisions from state revenue officers about potential liability for payroll tax. And so there is the need to reorganise, in some cases, the flow of funds to providers. We've been making sure our products support the capabilities that providers need in that landscape, and also that we can have the right partnership arrangements with other providers to support practices as they go through those transitions. And I think this is all part of us making sure that that GP sector is sustainable and can continue to grow into the future. I mean, there's obviously continuing corporatisation in that market, which is in some cases a response to labour issues, and in other cases an ageing population as GPs move towards retirement and look for new solutions for their practices. So there's some of the key things we're seeing, John, across the market.
Yeah, great. Thanks very much, Simon. Alan, I wouldn't have thought it'd be a webinar or a session without you getting this one. Someone's popped in there.
House prices.
Absolutely. So maybe a view on the question is around commercial and housing prices, but just your thoughts, probably capital city house prices over the medium period.
Well, look, we have something like a 5% increase in house prices from now over the course of the next year. What we're seeing is basically a situation where the number of new listings has gone up a lot, particularly Sydney, Melbourne, and it could well be there's some distressed selling there. We don't know yet. As a bank, we don't see it because people are not defaulting. So we would say, yeah, you could have a period where for a couple of months house prices do nothing or go backwards. We'll get some more data for November later this week. So I'm sort of okay with housing because I think there's still demand there. But when I come to commercial property, it depends which part of commercial property you're in. If you're in industrial, i.e. sheds for people to put their online stuff in for distribution, that's booming. So is essentially CBD. Hotels are good. And then you come to office, and office is not good. So you got vacancy rates 10 to 15% in Sydney, Melbourne, and in the A-grade buildings they're not going up, or they're not vacant at all. So that means B, C, D are sort of doing really poorly, and retail in the CBD is also not good. If I had to pick who's doing the best, it is probably Western Australia's fairly strong, but Victoria, for whatever reason, in our business, in our service of the property sector, look quite depressed. So I'm much happier about house prices than I am about commercial or office space prices, which I think have got some adjustment down to come.
Thanks, Alan, and you're clearly prepared for that question, so thank you very much. Look, folks, it's getting close to the hour. We said we wouldn't keep for more than an hour, so look, I'd just like to thank you all for attending our Health Insights webinar today. We really hope this was of value to you, and it's been an absolute pleasure to bring this to you today. And as was mentioned, it's our 12th year of doing this. So, yeah, again, thank you. For the NAB customers on the call, thank you for your support of the organisation of NAB and what we're doing in the sector. We're absolutely committed to the sector, as you can hear. We are open for business, and we want to help you grow and achieve your ambitions. So, if you need anything, reach out to your banker, reach out to me, find me. We will do whatever we can to help you grow your business and succeed. Big thanks to our panelists. I mean, having people like Alan Oster and Dean Pearson on the call is terrific, and our senior leaders as well. So thank you very much for the panelists for your contributions today. They've been really, really first class and well received. And I just do want to thank the team behind the scenes. These things don't come together easily, and I won't get too gushy here, but there's a lot of work that goes into pulling these together and making them go to our clients and our people on the call. So thank you to the team behind the scenes. 12 years is a big effort, and this year's been another great effort. Again, we are committed to the sector. Hopefully you picked that up. I won't say it again, but we are absolutely committed to growing health as an organisation. We've got the right support, from the organisation, the board, right to grow the health sector. So, we're absolutely on board there. This webinar will be available online after this event, so you'll be able to find that through various channels to view and to share with others. The CPD points are available. You'll get an email and you get uploaded certificate there. So it's a win-win for this one. Thank you again for your time. And good morning or good afternoon wherever you are. Enjoy the rest of your day. Thank you.